Caffeine is the first thing that comes to mind when you think about coffee.
But coffee also contains antioxidants and other active substances that may reduce internal inflammation and protect against disease. Several studies have suggested that coffee consumption was a protective factor against developing liver cancers, including hepatocellular carcinoma. In a meta-analysis of 12 studies, regular coffee consumption was associated with reduced hepatocellular carcinoma risk compared with no or occasional coffee.
Coffee contains large amounts of antioxidants, suggesting biologic plausibility for the protective effect.
Both regular and decaf coffee seem to have a protective effect on your liver.
Research shows that coffee drinkers are more likely to have liver enzyme levels within a healthy range than people who don't drink coffee.
Coffee consumption has been associated with a decreased risk for cirrhosis.
In a meta-analysis including 16 observational studies, compared with non-drinkers, coffee drinkers were less likely to develop cirrhosis.
In other studies, diabetes risk was lowest in subjects who drank greater than 6 cups daily and significantly reduced for subjects who consumed 4 to 6 cups daily. In addition, the risk of diabetes was lower even for small amounts of daily coffee consumption compared with non-drinkers.
Caffeine is a potent stimulator of smooth muscles and thus have an impact on bowel function.
In an observational study, coffee consumption was associated with a modest decrease in constipation.
Coffee consumption is associated with a dose-dependent reduction in risk of prostate cancer.
Men who consumed 6 or more cups of coffee per day had a lower risk of prostate cancer compared with non-drinkers.
Coffee consumption was also associated with a dose-dependent reduction in risk of fatal or metastatic prostate cancer.
Data suggests that high coffee intake may be associated with lower bone mineral density and increased fracture risk in females,
particularly those with low calcium intake. Coffee consumption decreases incidence of gout in a dose-dependent manner. Caffeine in doses typically consumed does not provoke
arrhythmias, and its routine use in patients who have or are at risk for arrhythmia is acceptable.